Hi, afternoon. Just giving you a little rundown of my experience Friday when I went to the Port of Spain General Hospital. I arrived there at 4:45. There were at least 50 elderly people in front of me, and I did not get to see the doctor until 11:15.
PM?
Yes. AM.
Oh, AM, okay, 4:45.
Oh, I left the hospital at 3:30 PM. The healthcare system now, I don't consider myself elderly in no way, but I felt it for the elderly people. Now I use the public healthcare because I love the testing. You can get testing for free, and I applaud that because we don't appreciate the healthcare system that we have in Trinidad and Tobago, where we can have access to certain, like x-rays, blood sugars, you name it, testing, etc. So when I got there, obviously, now something needs to be done with the nurses as well, because honestly speaking, they're rude to the patients, right? And these are elderly people, and they're asking questions because there are no young ones with them. So they're asking questions about, where do I go, but to be yelled at or spoken down in a derogatory manner, which is not nice. And there was a particular nurse that was not well that day, I'm assuming, and she was very, very aggressive towards the elderly. And I mean, when I went to the doctor, I couldn't even go to the doctor with my issue because I had to fight to actually see the doctor, because if I didn't take a picture of my card, it would have gotten misplaced. They couldn't find my file. So you could imagine their situation, and something needs to be done about that. The other issue is one pharmacy. They had to take someone from the pharmacy because she was more customer service oriented and she had empathy towards the elderly people to actually go across, come outside, talk to the elderly, say just now everybody will be seen about, don't worry about it, that kind of thing. If it wasn't for her, I would not have seen the doctor probably until after 2, because she took it upon herself to actually go into the filing room to look for my file. So you could imagine now, previously when I went to the doctor, she said, there's loose files in here. There's lose your card in here. Well, I mean, she's not supposed to say that, but she's speaking the truth. So something needs to be done about the wait time, 1. 2, the wait time for the pharmacy. I waited 2.5 hours for medication. And I'm young, and I have a back problem. So you could imagine those elderly people there waiting. Sometimes they come there at 6 o'clock, and they don't get through until 9 o'clock, 10 o'clock. There was a gentleman there who reached there from 4:30 in the morning. He did not get seen until 9:45. And he just went to let the person know, here what, I was first. Everybody knew he was first. They put his card all the way down to the bottom. Why are we treating the elderly people like that? I mean, I'm not going to give you my experience with the doctor, because that... When I went to the doctor, I know you all study hard, and I know, I applaud that. But you all start to need to listen to the patients. She was not listening to me at all. And as I said, I didn't come there to fight because I had to be on my best behavior so that I could get seen about. Because that is what you have to do when you go into public health. Good morning, good afternoon, thank you, yes, really patronize them and be on your P's and Q's and try not to aggravate the nurse or the doctor. So when I went to this particular, she's a very young doctor, and I was explaining to her, now I'm going through menopause. And I realized menopause is not a thing in Trinidad and Tobago. It's not a thing for doctors. It's not a thing for nurses. They bypass that, they ignore it, they push it under the table. So I had a hysterectomy. She told me, no, you're not in menopause. You've gone through menopause already. So I'm telling her, well, I'm giving her the symptoms of menopause. And she said, well, you know what? You need to see a psychiatrist because you are depressed. But no, I am just going through menopause. I'm having the symptoms of menopause. Treat me for the symptoms of menopause. And I will get through with the nutrition and everything. But you want to send me to a psychiatrist. You understand? And a lot of women are suffering from menopause. And we are ignoring. And if we go to the root, she even diagnosed me with cancer. She said, I had a hysterectomy, so she said, oh, so that the cancer would not come back. But I didn't know I had cancer. I did not know my hysterectomy was because of cancer. But you're not listening and you're not reading. I think that is the number one problem that we are having. They're not listening to the patients.
Thank you so much.
Thank you.
We'll take one more before we go back to Mohit.
Oh, sorry.
Thank you for sharing this.
Oh, it's her. Oh, sorry.
Thank you. Good evening, everybody. Natasha Nunez is my name. And I just kind of wanted to follow up to what Gillian said. Now, women over age 40, like myself and many women in this room, make up 20% of the population. Every one of them who has a period will go through menopause, which is a natural transition that marks the end of the reproductive cycle. While everyone experiences the transition differently, no one deserves to suffer as a result of the misdiagnosis, positive information, or dismissal of their symptoms, as Gillian just described. I and Gillian represent the Menopause Empowerment Network of Trinidad and Tobago, MENO-TT, which is a newly registered NGO dedicated to education, research, and advocacy around menopause. While the organization is young, we have set up a private Facebook group which now boasts of 770 members. Since we started this group in March of this year, we have noted the significant lack of information among this population of citizens about menopause, about the symptoms and the treatment options. And we are here today to articulate our own concerns as we are going through the transition as well as for those of our members who, for the most part, are not prepared for the onset of menopause, whether because of their age, the symptoms, or whether they go through an induction or induced into menopause by surgery. They are not treated with respect and dignity when they present at hospitals and health centers with menopause symptoms. They are not given information nor treatment options to alleviate the symptoms, which can be debilitating in many instances. They are not aware of the increased risk that menopausal women face for cardiovascular disease, diabetes, and other chronic illnesses like cancer and stroke when they enter menopause. They are prescribed medication for each symptom, as Gillian just described. The doctor wanted to send her for counseling and give her medication for depression, which is a symptom of menopause. So they are prescribed medication for each symptom, not taking into account the female reproductive system looks different for each person, including those who are going through a gender transition. And they are unable to access different types of hormone replacement therapy. Currently, there are many types: oral, patches, creams.
Natasha, if you could kind of bring it in terms of how you'd like the management of the system to change to accommodate for that, so we stay on track, please.
Get into that. So we would like for public healthcare professionals and the system itself to recognize menopause and women's health concerns in general with the care and understanding it deserves. While it's not a disease, it is a significant transition in a woman's life that should be embraced rather than feared. And women at this age, who are some of the most productive citizens in this country, should be enabled to live happy, healthy lives as we age.
Thank you. I saw a hand up in the back.
Hi, Gillian Trumpet from, I have to say MENO-TT. For me, what I do, because I'm going to the healthcare center in Santa Cruz tomorrow. So tonight I'll mentally prepare myself. No, it is the truth. I have to psych myself up and say, Gillian, you're going to wait and be patient. Because as I said, when I went to the hospital on Friday, I did not expect to wait so long. I expected a wait, yes. But there were people before me that came. People came after me that went in. people came in at 10 o'clock, went in before me. And yeah, because as I said, there was an issue with the file. And what I've started doing is I use my cell phone and I take pictures of everything the doctor has not written down, but like my tests. So I have all my tests on my phone as well as the card that they give you, because they couldn't find the card. And I showed her the time, which was the time I presented the card. When I took the picture, so you'll have the time when I presented the card to put in the box. So you can't tell me, obviously one of you lost the card. And it states Port of Spain General Hospital on a seat. So that is where I took it. Why we have to go through this? Something needs to be done in terms of, and as I said, the pharmacy. You can't have one pharmacy for the general hospital. Right. I can't wait 2.5 hours just to get some medication. What about the elderly? And that was my main concern, because who walking with a stick? Who sleeping on herself? I had to hold up a woman because she was sleeping on herself. And that's not right.
Yes, can we?
Yeah, just to add about my experience with the public healthcare system, I have not been a user previously, but of course, as I age, I'm developing symptoms of menopause, right? So I had nausea and dizziness. I decided to take a day's sick leave and present myself at the Diego Martin Health Center, which was a mixed bag. Very good service, pleasant people. And I think I only decided to go there because my good friend Gillian said, I am always in the hospital and health center, go, it's free. And I said, okay, I will register at the health center because it's right up the road from where I live, it's convenient, it's free. So I go there, get there at 7 o'clock in the morning, and I don't leave until after lunch because I have to register, I have to wait, I have to sign up, wait to see the doctor. And interestingly, when I did see the physician and told her my symptoms, she didn't want to hear anything about menopause, but she prescribed me anti-nausea medication, which I did not take. However, in the conversation that I did have with her, she recommended that I take a supplement, a B12 supplement, which I did, and it worked. So it's a mixed bag in terms of the services that the doctors provide, the conversations you have with them, even though they may not listen. In many cases, they may not listen to the patient. You could pick sense out of nonsense sometimes. I think I was lucky in that regard, that my illness was treated with the suggestion of the physician. But if I had known that I had to wait a whole half day just to hear that you need a B12 supplement, I would not have gone.
Thank you. A lot of hands in the back at the gentleman, and then the young lady in front here was identified earlier on. Because I want to be careful with people's medical information. So I just want to repeat what you said, that you were told when you went to get remediation for symptoms that you thought you were going through menopause, that the doctor advised you that through your hysterectomy, I think you divulged that to us, that she thought that you had cancer.
Yes, what happened? Sorry.
And if there was any diagnosis shared with you about that and any treatment received about that related to that?
No, she made a mistake because she just assumed that the hysterectomy was due to cancer because all my organs were fused, and she advised that I need a vulvar pap smear, but I can't pronounce the vulv smear, I believe it is. And she said you need to do that so that your cancer would not return. So I was like, I said I didn't even bother. I just did not bother. I just said, okay, I didn't even know I had cancer. And that was the reason why they did hysterectomy.
But how do you feel as a patient that a medical care professional is giving you information that did it turn out to be inaccurate?
Yes, it was very inaccurate.
How did you feel about that, though? Because, I mean, at the end of the day, I'm not medically trained.
Right.
You're not medically trained. We go to depend on the expertise of this person to guide us in our healthcare journey. And if you are being given erroneous information, that is profound to me.
So what I do, I do my research. I do exactly what that I've seen doctors do. I Google.
Darling.
Doctors Google.
Let me be responsible and advise you that is not the way to go. Okay? That is, I'll be irresponsible to tell you to stay with that path. People go to medical school for a reason. And while I understand you are being proactive and you are doing what you can do, what you should do is go to a medical health professional to get a proper diagnosis.
I agree.
Right? So I just want to be responsible and say that, because that's important, because this is going to be broadcast. Because I don't want people going outside and saying, well, I can Google and diagnose myself. That would be highly irresponsible, but it's a serious issue.
I understand.
All right?
I understand. And you see, if I did not know, because I tell you, I keep copies, I keep records, and I just let her talk, because I'm assuming she's tired, she's seeing a lot of
So did you
patients.
seek a second opinion?
No, I know I don't have cancer. She just misread everything in the file. Now, if I was not knowledgeable about my condition and understanding what it is I'm going through, I would have been left there in a mess. Now, I'm hoping that when I really do this test, I don't have cancer.
Well, that's what I'm hoping, that you get a thorough examination by someone to ensure that you don't have cancer, because I think that's important for your healthcare prognosis, right?
Yes, because I'm not sure if this is true, so I'm going to just need some clarification, because I've been told it's not easy now as a cancer patient to get services at the St. James Health Facility. You have to go through a screening to see if it is you are financially unsuitable. Am I correct?
I don't know.
Anybody? I don't know. I'm asking because I'm hearing that.
Well, we're glad that you're seeing this, because the lack of information is also going to be part of our report, that the public needs to be aware of what's available and what's the process to access what's available.
Yes, because I'm hearing that you have to fall below a certain bracket now to get the access to services. Because when my mother had cancer, we went to the St. James Infirmary, and obviously there was a wait period and that kind of thing, and nothing is, we understood you had to wait. So she was able to avail herself of the services provided, there. But I'm not sure now if it is that you have to fall under a certain bracket in terms of finances in order to actually access.
Well, your question will be certainly part of our report, so
Thank you.
that information can be disseminated to anyone.